So I'm going to throw it open for questions here, and I hope I didn't run over time here. I was perfect. I was on time. Holy cow, first time in my career. Okay. So I'd be delighted to have any questions or anything from anyone here on this. This is a big topic, and I hope you found it a topic that you can engage with.
So we are open, well, maybe I'll leave it attached. So we are open to questions. Are there comments or questions people would like to make?
Is this being taught now, the online stuff, to the new doctors coming up and things, so that they aren't quite as...
Okay, so really good question. Is this being taught to online doctors? I don't have an answer. Do you, Catherine? Are physicians in training, are healthcare providers in general in training, are they getting the kind of help to navigate this and deal with this in their interactions?
I don't think it's...
Microphone.
Come on over, just come on over.
Come on.
I'm a rheumatologist, so that's why I thought I could answer. So I don't think it's formally taught in our curriculum, but I know that certainly in our training programs, we're talking a lot about it. And there's a lot of discussion about how can we effectively use online tools with our patients and how to deal with that and how to deal with the fact that the patient comes with information from the internet and how to integrate that into our practice. So I think the answer is no in terms of formally, but informally in as we're training our graduates, it's an important topic of discussion.
Oh, sorry. So the eHealth Strategy Office, which is part of the UBC's Department of Medicine, they're actually doing some research right now to help to kind of incorporate eHealth, just kind of an online component to medical trainees and health professionals coming up. So,
And then I might also comment that the professional responsibilities for all the health science learners at the University of British Columbia was recently updated, and it includes clauses that are related to social media and use of online resources and so forth. So every health professional student, when they enter the University of British Columbia, and it's also expected of all of the faculty members, that they adhere to the professional responsibilities as codified there, and one of them is dealing with online information, social media, and so forth. So starting to infiltrate.
So let me pose a question then. One of the things I think about is not just the new people coming through, but what about the people who are already out there? Are they getting help? Say physicians who've been out and in practice for a number of years, are they getting the help to cope with this kind of thing and understanding the challenges? Are they getting, do they get continuing medical education credits for doing work in this area?
So I would suggest that there is interest in continuing medical education that's in this area, and I think that Ann Townsend will also touch on it in her talk, because that's actually the focus of the research project that we have underway, where we want to hear both patient voices and healthcare provider voices, so physicians, physical therapists, and so forth. We want to hear their perspectives about some of the challenges and how this influences the patient-provider interaction. So that's the purpose of that study.
And I think that's really important, because we're talking about an interaction here. We're not just talking about the providers on one side and the patients on the other. We want a successful interaction that's beneficial for patient health. And so you have to have people aware of the numerous challenges. There are technical challenges here. There are also the ethical challenges, for providers not getting their backs up, feeling like, oh, I'm being challenged, in this kind of thing, in my authority. It used to be, and I'll say this because I've been involved in education for a long time, the idea was the professional was a source of wisdom, and you just listened dutifully to the professional, and you followed doctor's orders to the letter, or you were deemed non-compliant, right? A troublesome patient, and there'd be various things on the chart about troublesome patients and that. And hopefully we're moving away from that kind of model of a one-way relationship where you follow the orders and the doctor gives the orders, and that it's a much more interactive, responsible kind of model.
I have a question from one of our webcast viewers. Dr. McDonald, what do you think about the reliability and validity of online tools for treatment and outcome measures?
I think it's really important that you get disinterested third parties actually looking at them and rating them. What you need in this world of overwhelming information is, and remember this from one of my colleagues at the Center for Applied Ethics at UBC, was you need good editors. You need people to verify what's going on. So it's almost like you need a stamp of approval on some of the things, because I think that's what we really need. And hopefully through the Arthritis Research Center and through some of the projects and stuff, the Cochrane collaboration and various other kinds of things, you're getting that kind of certification process. As individual patients, we're not capable of doing that kind of thing, but we can hopefully have people who will, in a disinterested way, not moving with some commercial interest, and not, if you like, being on the margins of, if you like, medical knowledge and medical research, but at the core, be able to help certify some of the stuff. So that's crucial.
Please join me in thanking Michael McDonald for his remarks. Thank you.